Welcome back to the Express podcast on integrated pest management, brought to you by Orkin and AHE. I'm Dr. Ron Harrison. Our third topic is documentation. Although you may not realize it, documentation is an essential component of all successful pest management programs. It helps assess the effectiveness of your IPM program and preventative measures. It helps evaluate trends of emerging pests. It allows you to track pesticide applications. It meets the Joint Commission's accreditation requirements and also demonstrates accountability for your pest management provider. Some of the methods of documentation will be on a service report that the pest control professional will provide. It can come in an electronic version, and also documentation can be your pest sighting log that we talked about, that someone should be designated of jotting down any pests that are actually seen. Some of the components of documentation will be description of the scope of service, frequency of service dates and inspection, target pests, facility floor plans, location and description of remedial measures, pesticides that would be used, the brand names, active ingredients, EPA registration numbers, service reports after each visit, and also corrective actions. Now this may seem like a lot of things, but your service provider will actually have a service ticket that will have all of those things on it. They will fill it out and then provide it to you so that you make sure you have it in a file, that you know what's going on at all times. Regularly review these service tickets. They aren't just to be put away and never looked at again. Corrective actions need to be checked off so that they're taken care of. Also, the communication about what's on that service report is so important, not just with one individual, but everyone that's a player. Also, use the documentation to work with your provider to adjust the IPM program. Maybe something isn't working, and so therefore understanding what's going on your documentation can help solve that problem. If you don't have a good documentation program, then you don't have a good IPM program.